Hi, I want to spend some time talking about healthcare. Before I get into the specifics of my situation, though, I want to describe a little bit about just where my wife and myself are at with our healthcare needs and everything of that sort. So I was employed by a company up until basically the end of 2015. My wife has been self-employed since long before that, and I basically had her as a dependent on my company plan. And at the end of 2015, I actually resigned that position and I became self employed myself. And this meant that we had to start getting healthcare on our own as self employed people. And the Affordable Care Act had come into play not too long before that. I think it was 2014 or so. And so we were able to go on the market, and we went through healthcare.gov and all those fun things and found insurance. There are two main hospitals slash medical facilities in our town, and uh, they don't have their own insurance companies, but there are certain insurance companies that cater to one of the two. And so we basically preferred to go with insurance that was similar to what we had had before. And so we actually ended up going with the same company as what we had before, which you can see on the screen here is Health Alliance. And that seemed like the logical thing to do. We're both healthy. We don't have any pre-existing conditions that we have to worry about. I haven't been to the doctor in way too long, and so my wife goes once a year or whatever. So we don't have any significant expenses now, or that we anticipate happening on a regular basis. But as you get older, you never know what's going to happen. So I want to go through and talk about where we have been at with Health Alliance. And when I was working with the employer, I don't remember exactly what I was paying per month, but it was on the order of a couple $100, and that was for a typical HMO plan with copays, where if you went to a doctor that was in your HMO, you would pay 20, 30, $40. I don't remember per visit. And same thing with specialists and so forth, um, up to some sort of maximum per year. I never went to the doctor, so I never really, I didn't know a lot about that, and I haven't paid as close attention to insurance as I probably should be, just because I've been blessed to not need to. So anyway, if we look at the way things happened in 2016, I knew that we would be paying more than we were through the employee plan, because we would be paying everything ourselves. And sure enough, that is what happened. In 2016, we got on a bronze level plan. Healthcare.gov has, I think it's gold, silver, and bronze. Um, and in 2016, I was paying $300 a month. My wife was paying $262 a month. And this was for a high deductible plan. Each of our deductibles were $6,000, and that is for visiting in market providers. So if we were to go with out of market providers, the deductible is actually double that. So the deductible is $12,000. And excuse me, the in market and out of market deductibles are completely independent. So you have a $6,000 in market deductible plus potentially a $12,000 out of market deductible, depending on where you go to. So in theory, you could have $18,000 of deductibles. I'm ignoring the out of market part though. And so I was paying $300 a month. My wife was paying $262. We each had the $6,000 deductibles. And so what that meant was that if I had any expenses over the course of a year, I paid 100% of everything until that $6,000 deductible was met. So what that essentially means is that I would have to pay about $9,600 each year before anything actually be covered. And so that was a problem because it actually prevents us from wanting to go to the doctor knowing that we have to pay 100% of everything. So it really is catastrophic insurance is the best way to look at it. And so anyway, in 2016, we would have had to have paid between the two of us close to $19,000 before insurance actually started kicking in. Over here in these columns, I'm just keeping a sum of what we actually paid out, and this is ignoring any actual doctor bills or anything like that. This is strictly the insurance costs themselves. So we were at 300 and 262, and then in 2017, mine jumped up almost 80 bucks. Maria's jumped up $40 or $60, and so our deductible also jumped up $550 a piece. And so the total amount that we would have to pay before the doctors kicked in went up even more. 2018 jumped up another $1,000. The deductible stayed the same, so our monthly payments just went up that much. Mine went up over 1,000, and Maria's went up 800. 2019, you can see that it's going up more. 2020, the deductible went up a couple $100, and for 2021, the deductible has gone up another $150. I'm now up to them wanting me to pay $559 per month. My wife's at $423, so you can see that it's just getting unreasonable. You can see that so far for just our insurance costs, we've spent over $47,000, and that's basically all of our actual medical expenses have been on top of that, because thankfully we've been blessed to not have this deductible amount of medical bills in any of these given months or any of these given years. So basically, the insurance company hasn't really paid anything for us, and so that's not quite fair. They have paid for Maria's annual checkups, so there's been a few $100s that's been paid for that, but essentially they haven't paid much, and we've paid a lot. And so this is what caused me, this finally got painful enough that it caused me to really start looking at options. And one of the options that the first thing that you do is you go to healthcare.gov, and I punched in my basic information for next year, and healthcare.gov is telling me that the lowest quality plans are averaging over $1,000. You can see that right now we are paying monthly. It's going to be close to $1,000 right now, and then if we look at this, so you can see that I'm actually on one of the cheaper plans right now, and if we look at some of these others, this has a $16,000 deductible for the family, which is even more than, we're at a little under 14,000, and so that has a higher deductible. This is slightly better. One of the things that I should mention is that we are on a high deductible plan that's special, and one of the nice things about that is that it does actually, it's this one right here, is what we're on. It lets us actually have a health savings account, which lets us grow some money tax-free, which is a perk. I will not deny that at all. But you can see though that for the one we're on, you have no charges once you've spent the close to $14,000 between the two of us. For this plan up here, there are a billion different plans, and basically, so there's only the two or three that are below $1,000. Then you quickly jump up to over 1,100 and 1,200, and it really takes off from there. And the decision all ends up being based on how much you think you're going to need healthcare. Um, this was just becoming unreasonably expensive, though, for our particular situation. So I started looking at something called Christian Healthcare Sharing Ministries. And basically, what these are, they're not insurance. It's a group of people who profess to be Christians that are all organized together, and they basically pay each other's bills. Um, and so whenever a bill comes in, assuming that it meets the list of things that everyone has agreed will be covered, you then submit it to a managing company, and based on the amount of money that they're collecting, they will then pay that. Um, Again, it is not insurance. There is no guarantee that they're going to pay. There are a few companies, though, that have been in business for dozens of years, and they've always paid. For everything that they say they're going to pay, they've always paid. And so that's worked out pretty well. There are a couple of main companies that seem to be the big players, and the specific one that you pick really, it just depends on your specific situation. I made up a little bit of a spreadsheet here, though. A couple of the main players are Christian Healthcare Ministries, which is CHM, and then there's another one called Samaritan Ministries. Christian Healthcare Ministries has been around since the 80s. I believe that Samaritan has been around, I think, since the 90s, but I'm not entirely positive on that. Their prices are radically different than what you're going to see for insurance. So if we look at 2021's plans, this is basically the plan that we were set up for. I must have something wrong on that other spreadsheet. We were looking at paying $1,070 per month. And again, that's to begin with. Then we each have to pay the $6,900 on top of that before anything's actually covered. Once we've paid that in market, then everything else is covered. It does include prescription coverage. It includes ambulance, chiropractic. My family actually, colonoscopies are an important thing because of colon cancer, so that is obviously covered. And the main hospital system that we would go to here in town, which is called Carl, they do have coverage there. For Christian Healthcare Ministries, if we go with their top-of-the-line plan, for the two of us, we would be paying around $377 per month. And the way that works is that they will pay up to $125,000 per incident automatically, but then the supplemental coverage that we're paying for up here, which is $33 a month, will let them pay up to basically no limit for the maximum on per incident cost. So that's the way that part works. You pay your $300 directly to Christian Healthcare Ministries, and then they spread it out to whoever needs to help with paying bills. The way that it works per incident is that if the charge is excuse me, if the charge is less than $500, you pay it. So if you go to the doctor for any sort of annual visit, or just because you have a bacterial infection, whatever, if the charge is less than $500, you pay it entirely. And if the charge is more than $500, if it ends up being more than $500, if it's $500 before any discounts, then they will pay everything. It's shared out to the other members in Christian Healthcare Ministries, and it gets paid for you. Now, I mentioned discounts because, generally speaking, with healthcare providers, my understanding is that you can pretty well always get a discount if you are paying on your own without insurance. Essentially, the healthcare providers negotiate a rate with the insurance companies so that the insurance companies pay a reduced rate, and you can negotiate on your own behalf if you are paying for everything yourself. and you can save at least 25% up to 60%, sometimes even more, depending on the specific situation. So what that means is if you had a bill that was $600, but you got it negotiated down to $400 because the bill started out over $500, they're going to pay everything. And so that's kind of the way that works. Christian Healthcare Ministries does not cover chiropractors. It does cover colonoscopies. And for the Carl coverage, you do have to at this time, you do have to actually ask Carl for a discount. That the discount part is not automatic at this time. My understanding is that might be changing, but at this time, that's not the case. One thing I do want to mention for ambulance coverage, one recent change that they made, previously ambulances were covered from medical facility to medical facility if it was needed, but ambulances were not covered from the original site to the first medical facility. A recent change is that those are now covered as long as that original transport has been ordered by a doctor and they can see that was the case. So that's Christian Healthcare Ministries. There's another option called Samaritan Ministries, and their typical plan is about $100 more per month for the two of us. And they will cover more before they have to go into the supplemental part that's talked about here. One of the significant differences between the two is that with Samaritan Ministries, you get a name each month of who you need to send this price per month out to, and then you send it to them directly. So you'll get several different names each year of who you should be sending your money to. With Christian Healthcare Ministries, you send the money to the ministry, and then the ministry distributes it out. So that's one difference. The deductible is slightly different with this one. Samaritan does give you 40 chiropractor visits. It does not cover colonoscopies, and Samaritan does have an agreement with Carl in place, so that because they know you're involved in Samaritan, they just automatically give you a particular discount. One other thing that I want to talk about, though, is prescriptions. With a regular insurance plan, obviously your prescriptions are covered. With Christian Healthcare Ministries, any drugs related to a specific incident are covered while the incident is occurring. So, if you have medicine, antibiotics, whatever that you get related to an incident, medicine related to a surgery, whatever, those are covered. But once it gets a certain number of days past the incident, if you have maintenance medication that is needed continuing after that, it is not covered. And so, there are certain situations, and one of the things that concerns me about this, you might find yourself in a situation where you have maintenance medication that you might need to take for the rest of your life. If that's the case, the cost for that is going to be on you. And so that is a definite thing that you need to be aware of with this. Samaritan actually does cover the same thing with the incidents, plus it will cover up to 4 calendar months of maintenance drugs that go along with this. So that's just a rough overview of a couple of these. And I would encourage you that if you're considering this, there are a couple of things that you should look at. The Christian Healthcare Ministries, the website for that is chministries.org, and they've got a good website here that talks about how everything works. The pricing is pretty straightforward, and you can actually click on their guidelines page, and you can see that last year they shared almost $500 million. So this is a good sized organization. It hopefully is large enough that you don't have to worry about it going out of business or anything like that. But the CHM guidelines that are discussed here, that is actually a 63-page collection of exactly what they cover and what they don't. And you really do need to read through this and make sure that you are clear on everything about it before you consider something like this, and because these guidelines describe what's covered and what is not covered. Um, SamaritanMinistries.org is the website for the other one, and they have similar things that are described in this website as well. For us, we ended up going with Christian Healthcare Ministries. We we like some of the details here. It's a little bit cheaper per month, and we kind of like the fact that we can pay the ministry directly and just set up an auto pay and just have that automatically taken care of. We do have some concerns, though. We do not have a concern that the bills will be paid for what is covered. Apparently, this ministry has been around, like I said, since 1980, and it has paid out every single time. And so we're not terribly concerned about that part of it. The things that we're concerned about is simply what is not covered. The prescriptions, for instance. We have a friend that has $6,000 a year or so in maintenance medication that they're going to have to take for the rest of their life. But if you look at the comparisons between that and what we have to look forward to from Health Alliance, even with that $6,000 charge per month or per year, we would have been paying all of that with the Health Alliance plan anyway, and a lot more, excuse me, of a premium on top of that. And so prescriptions are one consideration. Other things that are not covered, contraceptives are not covered. That could be an additional expense for some people, depending on your situation. Psychiatry type things are not covered. That could be a consideration depending on the situation. Just various specific things like that. If I go back to the guidelines, let me find the specific spot here where it talks about what is not covered. Yeah, bills ineligible for sharing. That's a quick place to go to real quick. If I jump to the bills ineligible for sharing, you can see that basically they don't cover anything dental unless you break something due to an accident. And incidental stuff, they don't cover any eye care. They don't cover any hearing stuff, no chiropractors, no routine maintenance prescriptions, no wellness visits. You don't expect cosmetic surgery, nothing for birth and infertility testing. So basically, you can read this. I don't need to read all this for you, and I encourage you to look at the guidelines also. Prosthetics are not covered. So this is something you need to be aware of. And this list right here is really the important list that you need to make sure that you are okay with, because you're going to be paying for all of these. Long-term nursing care here. That is a definite consideration. The other thing that you have to be aware of with these is that this is a Christian health care sharing, and you have to actually agree to the principles that have been put forth here for you to be able to actually participate in this. And for some people, that could be a consideration. There are things like no excessive alcohol use, no illegal drugs, no sex outside of marriage, things of that sort. You have to attend church on a regular basis. So that could be a consideration for some people. Anyway, this is just a brief overview of where we are at with this. At this point, I can't really talk about how well everything works because I simply have not been through that yet. The things that I read about indicates that we should have a good experience, but I can't really speak to that. but this hopefully gives some insight into our decision-making process, and hopefully it might be helpful to some of you.